Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Alzheimer's disease. Alzheimer's disease is the most common cause of dementia that includes loss of memory and loss of cognitive or judgment capacity. Alzheimer's disease is a progressive degenerative disease of the brain, and these changes are irreversible. What is the histopathology of Alzheimer's disease? We have in the brain biopsy, we'll get extracellular deposit, amyloid or senile plaque containing beta amyloid, apolipoprotein E, ubiquitin, presenilin, and macroglobulin. We have also intracellular deposit. These are the neurofibrillary tangles containing hyperphosphorylated tau, a microtubule associated protein, and ubiquitin. So extracellular deposit is the plaque, intracellular deposit is the neurofibrillary tangles. Alzheimer's disease is sporadic, okay, but about 5% of cases are autosomal dominant. So the family history is also important because 5% patient has definitive family history. Patients with Down syndrome, that is trisomy 21, have a high incidence of Alzheimer's disease, and that Alzheimer's disease begin in the fourth decade. So that begin in the fourth decade, and it is very common in a patient with Down syndrome. Okay, so this is the picture I have picked up from Microsoft PowerPoint, Creative Commons Online. So if you look at that, Alzheimer's disease, person age usually above 65. As the age advances, possibility of getting Alzheimer's disease also increases. There will be confusion, time and location, difficulty completing familiar tasks, misplacing items, first of all, memory loss, difficulty solving problem, poor judgment, unfounded emotion. Person may suspect other people. The man may suspect the woman. Someone is stealing money from his wallet. Difficulty with word. Right word is missing. Cannot utter the word. Okay. Trouble, images and spaces. Withdrawal from social activities. So this is the healthy brain. These are the neuron and the axons here. What happened in Alzheimer's disease? Brain is atrophied. This lateral sulcus is very prominent here. Okay, and we are also getting the tangle in the neuron. This brain contains a lot of neuron, the cortex, and that neuron contains the, in Alzheimer's patient, contains the neurofibrillary tangles. Also, this is intracellular. We have also extracellular deposit. There is the plaque. Okay, this is extracellular deposit around the neurons. This inside the neuron, the tangles. What are the clinical features? Memory impairment, intellectual loss, aphasia, person cannot talk, agnosia, apraxia, difficulty learning and retaining new information and handling complex tasks, impairment in reasoning, judgment, spatial ability and orientation, mood changes, apathy, agitation, paranoia, hallucination. There is false sensory perception and psychosis, some type of schizotype of behavior, schizophrenia type, terminal mute, incontinence, cannot control the bladder, last stage, vegetative stage, bed bound state. Death ranges from 2 to 15 years after the onset of symptom. So this is another picture, two pictures from Microsoft PowerPoint. If you look at that, this is a normal brain, this is the atrophied brain of Alzheimer's disease. Okay, so here ventricles are larger because of loss of the brain tissue. The ventricle will go further. Ventricle will be larger and containing cerebrospinal fluid. So we call it hydrocephalus ex vecu. Okay, there will be shrinkage of the hippocampus. Hippocampus is the area for memory. Okay, there will be also a problem in the other part of the limbic system that will cause the psychosis, agitation. That may happen. On the histopathological slide, what we are seeing neurofibrillary tangle inside the cell. Outside the cell, we are getting the senile plaque. We'll get plaque outside the neuron, and certainly eventually we'll lose the neuron. There will be proliferation of the neuroglial cell. We call it gliosis. And as a whole, our brain will be atrophied, although ventricle is enlarged. Eventually, it leads to hydrocephalus ex vecu. Okay, what is the clinical diagnosis? Alzheimer's disease history, clinical examination, mini mental status examination, neuropsychological evaluation to exclude pseudodementia that is caused by depression, chromosomal testing if we think there may be some familial history. We can test the blood as well as the cerebrospinal fluid. CT or MRI of the brain is essential to look any type of other type of lesion inside the brain. Electroencephalogram that assess the brain activity, the neuron activity, and the tracing of the neuronal function. Blood test for metabolic, endocrine, and nutritional disorder. This is also very important to us due to adverse effect of some drug, some metabolic disease, okay, and endocrine disorder or nutritional deficiency may lead to the features of Alzheimer's disease. But whatever may be the clinical diagnosis, our definitive diagnosis only after the death of the patient. If we study the brain, we'll get the pathological changes in the brain, typical for the Alzheimer's disease. So autopsy is the definitive diagnosis. Treatment should be done by a psychologist and with consultation with the neurologist. There is no cure for the Alzheimer's disease. Alzheimer's disease is incurable. Patient safety to prevent accident. Person may be involved in road traffic accident, and person cannot turn off the stove, so he may or she may fall on the ground. So proper nursing and caregiving is very important to them to prevent accident. Behavioral therapy may be required. Cholinesterase inhibitor, tacrine. These are the promising drugs for Alzheimer's disease. It increases the level of acetylcholine in the brain. Another one is NMDA receptor antagonist, memantine. Okay, so idea is that this will just provide symptomatic management, not a permanent cure. Symptomatic treatment of neuropsychiatric disorder, some antipsychotic drug may be required in some person, but this treatment should be consulted with a neurologist or with a psychiatrist or both. And that's all about the Alzheimer's disease. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.